All right, let's tackle lymphomas. I know, it's a topic that can feel ridiculously complicated. But what if I told you we could make it simple? We're going to do it by following the life story of just one single cell. And I promise, by the end of this, you'll get it so well, you'll never have to cram this stuff again. Let's dive in.
This sentence right here, this is the whole game. This is the secret key that unlocks everything. It means we're not just memorizing a list of diseases. No way. We're following a story, a cell's biography, and just learning where the different chapters can go wrong. So let's start that story right at the beginning. So where does our story begin? Well, it all starts in the bone marrow. And here we meet our main character, the common lymphoid progenitor. You can think of it like a brand new stem cell standing at a crossroads with a few different career paths to choose from. So, our little cell has three main options. It can become a T cell, an NK cell, or the one we care about today, a B cell. Each one gets its own special protein marker. Think of it like a corporate ID badge that says who they are and what they do. Now, they're all super important, but the lymphoma story, that is overwhelmingly about the B cell. So that's the journey we're going to follow. Okay, decision made. Our cell is all in on becoming a B cell. Its entire early life, basically its childhood, all happens right here inside the bone marrow. This is the first major stop on our tour. While it's in the marrow, it's basically going through school. It starts as a pro-B cell, then grows up into a pre-B cell, and finally becomes an immature B cell, ready to graduate and see the world. But here's the thing. One of these stages is really, really important when we talk about what can go wrong. And this is it. The pre-B cell stage. This is a huge checkpoint. If our cell goes off the rails right at this moment in its development, it leads to a very specific and very common type of cancer. So the big question is, how would we even know? Simple. We check its ID card. A pre-B cell has a very specific set of markers, but there are two you have to burn into your memory: CD10 and TDT. When you see those two markers together on one of these cells, it's not just a clue. It's the smoking gun. It's the fingerprint that tells you exactly what you're looking at. So lean in, because this is pure gold. If you remember one thing, make it this. CD10 plus TDT equals ALL. That's the mnemonic. It's a simple little equation that connects the cell's identity directly to the disease. It's just that easy. And boom! This perfectly proves our main idea. A cancer of a pre-B cell turns into precursor B-cell acute lymphoblastic leukemia. The name of the disease is literally telling you the cell's life story. See how that works? Okay, let's keep following our cell's journey. So, our little B cell has graduated, it's left home, the bone marrow, and it's traveled to a lymph node. Right now, we call it a naive B cell. Why? Because it hasn't seen any action yet. It hasn't met its first enemy or antigen. And right here, it's about to face its next big test. So what happens if this cell just never gets the call? It's just wandering around, never finds an antigen to fight. Normally, it has a built-in self-destruct sequence called apoptosis. It's a safety feature. But what if that self-destruct button is broken? Well, then you get chronic lymphocytic leukemia, or CLL. And again, the definition tells you the whole story. It's a cancer of naive B cells that have essentially forgotten how to die. They just keep piling up. It's a direct consequence of that one broken safety switch. And you guessed it, these rogue CLL cells have their own unique ID card. They've got the standard B cell markers, of course, but the two that just scream CLL are CD5 and CD23. And that brings us to our second killer buzzword of the day. If CD10 plus TDT is ALL, then CD5 plus CD23 is CLL. It's another one of those beautiful, simple rules that just cuts right through all the noise. Okay, so let's back up. What if our cell does succeed? What if it encounters that antigen it was born to fight? Well, now it's inside the second major location of its life, the lymph node. And you've got to picture this less like a room and more like a bustling city with different neighborhoods or zones. Now here's a spot where people get tripped up. Remember we said CLL is CD5 positive? Well, there's another lymphoma that comes from the lymph node's mantle zone that's also CD5 positive. So how do you tell them apart? It's all about the tiebreaker. For mantle cell lymphoma, you look for cyclin D1. For CLL, you look for CD23. That's how you tell these two cousins apart. Okay, let's follow our B cell deeper into the lymph node, into the most chaotic, action-packed area of all, the germinal center. This place is wild. It's like a special forces training ground. The B cell gets in there and starts multiplying and mutating at an insane rate, all to become a better fighter. It's amazing, but all that high energy, it comes with a high risk.
And when things go wrong in this hyperdrive zone, they can really go wrong. This is the birthplace of some of the big-name lymphomas, like follicular, DLBCL, and Burkitt. And guess what? We have another fantastic rule here. Tumors from the germinal center are often CD10 positive. Yep, the same CD10 from ALL, but here it has a totally different meaning. It's telling us about the cell's location, not its age. Context is everything.
So our B cell has survived the brutal training of the germinal center. It's a seasoned veteran now, an expert, and it has two final career choices. It can become a long-lived memory B cell waiting for the next fight, or it can mature into its ultimate form, the plasma cell. We're going to follow it as it takes that final step.
The plasma cell. This is the end of the line. It's not a soldier anymore. It's an arms factory, just churning out massive quantities of antibodies. It's so specialized, it even ditches its old B-cell ID badges and gets new ones, CD38 and CD138. But when a powerful factory like this goes rogue, that's what causes multiple myeloma.
And here it is, the entire journey, the whole story, on one slide. Just look at this. It's so elegant. We start with the pre-B cell in the bone marrow. That's ALL. Then the naive B cell that forgets to die. That's CLL. Inside the lymph node, the mantle zone gives us MCL, while the chaotic germinal center is home to follicular, DLBCL, and Burkitt. And finally, the fully matured plasma cell factory, which can lead to myeloma. Every single disease is just a snapshot, a single moment in this one cell's life.
So what does all this actually mean? I mean, we've just mapped the biography of a cell directly onto a list of complex diseases. It's a powerful way to learn for sure, but it also raises a much bigger question. If we know exactly where in a cell's life story a cancer starts, how does that completely change the way we design drugs to fight it? That isn't just an interesting thought. That's the whole future of personalized medicine. And it all starts by understanding this one simple journey.